I didn't see myself in this position. Nor did I see myself wanting to become a nurse while I was in YouthBuild. It came about because I wanted to become somebody. I wanted to put value to my name. I didn't want to continue my life the way it was before YouthBuild.
I didn't know what to do with my life. I know I want to do something. I want to be someone for my daughters. And YouthBuild Just A Start, it's a door. Just open the door for my future.
So whenever you feel like somebody's challenging you or somebody's trying to hold you down, prove them wrong. Be successful, right?
Where do you see yourself in 5 years? How do you budget your money? How is your family circumstance at home influence your education or your future plans in your long-term career goals? As a transition specialist, I would always be with the student for their next plan in life, whether it's post-secondary or certification program or job placement. Research the job market, find your passion, your ambition, and use all that into educating yourself about the positions that are out there in the competition. Also, example, the healthcare field is a growing field, and explore there's more than just becoming an RN or a dental hygienist. Is very broad, and there's opportunities for growth within that.
The healthcare sector is definitely a very promising field for young people. Patients of diverse cultures and backgrounds are most comfortable receiving care from people who look like them, who speak their language, and understand where they come from. So it's really important for young Latinos, young African American, young Asian students, anybody who brings a culturally diverse piece to take part in the movement towards going into healthcare. The sooner you know that you want to be in healthcare, that's a time when you have to start preparing. So make a plan, commit yourself to studying very hard and getting the best grades possible, especially in your sciences, your biologies, and your chemistries. Next, I think students need to make sure that if they have any opportunities to volunteer or get any type of experience in a hospital or healthcare setting, they should do that. And last but not least, wherever you go, make a good impression. Make sure that you dress professionally. Make sure that you stretch out your hand and you shake people's hands. Make sure you say good morning. Make sure that you show that you're willing to take on whatever it is that it is asked of you. After finishing high school, I was pretty sure that I wanted to pursue a four-year degree. However, I know that a four-year degree is not for everybody. There's many other ways in which people can achieve and enter the health professions. One of them being a two-year program.
When I got into Bunker Hill Community College, I didn't know what exactly I wanted to do or what avenue I wanted to take, but I knew for a fact I wanted to help people.
I care a lot about people. After study, I studied a little bit more about health cares and about jobs that they teach on YouthBuild. I decided to become a nurse assistant.
A couple of semesters passed by, and I noticed that I had almost all the prerequisites for the nursing program.
After doing 1 month on the Red Cross for nurse assistants, I decided to go for Bunker Hill and become a medical assistant.
The American Red Cross Nurse Aid Training Program allows a student to earn 2 certificates, a home health aid certificate and a nurse assistant certificate, as well as CPR certification for the professional rescuer. So within those 3 weeks, we're getting you ready for the nursing home. The last week of the program is 4 days in long-term care, caring one-on-one with a resident. We expect them to be able to work with a team, so everyone gets to be the patient and everyone gets to be the nursing assistant during the training. The nurse in the class that's your teacher, we say that's your supervisor when you go and get a job. So there are 4 places that our graduates can get employment, can expect to get employment. Long-term care, nursing homes, assisted living facilities, and again, they either hire home health aides or nurse assistants, home care as a home health aide, and in hospitals.
Now I'm working on Cambridge Hospital as a temporary employee. I work 40 hours a week, and I love it.
You know, I didn't think I was going to be a nursing student working with a nurse, and back then I probably would have thought, nurse, me, please, you know. But now look at me, I love it. You know, I love helping people. I love I just love it.
What's most rewarding about my job, I honestly could say, is the smile of the student when they first receive their first employment or where they find the career they love.
Our career department had a class where she showed us the career ladder, and I envisioned myself climbing that ladder, and it made me feel positive that I would be able to reach my career goal, which is to become a labor and delivery nurse.
Career counseling helped me in many ways. They cared for me, they cared where I wanted to go, and they actually brought me on field trips to see what I want to do and what I would be comfortable with.
My challenges would be, managing the schedule between me, my kids, and school. I feel like that will be a small barrier, but other than that, I feel like I'm excited. I'm ready to go. I'm ready to go and get my career, be somebody.
Achieving your goal is not necessarily about having a perfect path to success. It's going to be running into obstacles or challenges, figuring out how to overcome them, and then finding success in the end. And that's what will get you there.
My steps for me to get to where I want to be is me being in YouthBuild Just A Start every day, receiving my diploma in 2013, entering a community college for 2 years, get my associates. After that, just keep going forth with my career.
Some of my future goals are to finish Bunker Hill Community College with my RN degree, to continue my education and go to UMass Boston and apply for their 18-month accelerated program for my bachelor's degree in nursing. And at my own pace, after I get my bachelor's degree and working in the field, I would love to go to Boston College and get my master's degree so I could be a nurse practitioner.
Hi, my name is Kevin, and in 10 years I'm going to be a psychologist.
In 5 years, I want to be a pediatric nurse working with babies and young children to eventually own my own business.
YouthBuild, it kind of really did change me in a way. It was kind of like a tunnel, like, this is bad me, go through the tunnel, I come out with a book bag, my stethoscope on my neck, like, yay. But, yeah.
What makes me most hopeful about my future is everything. That's all I can say, it's everything.
We the people of YouthBuild Just A Start will dedicate, challenge, and empower ourselves to be responsible to and for each other. We have made this commitment to teach and to learn, to respect each other as we would like to be respected, to recognize and accept our tremendous potential, and to make positive efforts in building our lives, our families, our program, and our society. YouthBuild!